Hello guys, my name is Larry. Welcome to the channel. Hey, I found an article in a U.S. Veterans Magazine the other day, and I thought I'd pass this along to you because this is something that I had been questioning people about a while back and just didn't know where to go with it. And it is what veterans need to know about medical coverage. It's actually an article put out by Darren Davis, United States Army veteran and Humana Veterans Executive. I don't know who he is, but we're going to kind of go over what he's talking about here, and maybe this sheds some light on a topic that you might have rolling around the back of your mind just like I did. During the Medicare Advantage annual election period, AEP, which runs October the 15th through December the 7th, individuals eligible for Medicare can select their health insurance plan for the following year. For veterans, this can be a confusing time. It was for me, especially if they receive benefits through Veterans Affairs. I do. A little small check, $165 a month. But I'm still counted in there, right? Yes, sir, I am. As someone who works closely with veterans to help them to understand the role of Medicare, I'm sharing some of the questions I receive most often. Here it goes. This is a bullet. If I have health care benefits through the Department of Veterans Affairs, do I need to enroll in Medicare when I become eligible? I've asked myself that 100 times. And the answer to that question is yes. The VA encourages you to enroll in Medicare to complement your VA health care benefits. If you need care from a non-VA hospital or doctor, Medicare can provide coverage. Boom, dot. Having a Medicare plan means you have coverage if funding for VA health care changes in the future. And God knows, we don't know where that stuff's going to go, right? None of us do. If the VA only authorizes certain services at a non-VA or VA authorized care facility, Medicare may cover additional services the VA can't. Hey, that is a plus. I guess it really depends how sick you are. And if you get sick a lot, especially as we get older, which we do, it probably is good to have Medicare on top of your VA care. If you cancel Medicare Part B coverage, you cannot choose a Medicare Advantage plan until January of the following year when you can enroll in Part B, even if your VA health care benefits change. A delay in Part B enrollment means a financial penalty when you sign up. Didn't know nothing about that, but it's letting me know there could be a penalty. With Medicare Part D, which is coverage for prescription drugs, you will have the option to get medication prescribed by non-VA doctors and use your local pharmacy. Part D coverage is only available through private insurers and can be a standalone plan or part of a Medicare Advantage plan. Now that is pretty important. So I guess to sum that all up, let's say for instance you go to the VA and for some reason, just for some ungodly reason, or not go to the VA, but you went to a doctor and the VA didn't cover it, at least you'd have Medicare to cover the offset expenses that you're going to have there. So that is pretty good. Excuse me, I got to cough that crap up. Original fee for service Medicare is the government managed program and only includes Part A hospitals and Part B doctors and outpatient services. Medicare Advantage plans offered through private insurance companies include Parts A and B and additional benefits. That could help reduce gaps in coverage. For example, Humana USAA honor plans available to anyone eligible for Medicare are designed with veterans in mind and include a zero monthly plan premium. I think my dad had something like that before he passed away. Part B Medicare premium reduction, worldwide coverage for emergency care, unlimited on out-of-pocket costs, and dental, vision, and hearing coverage. So if you're a veteran like me, you're not getting any dental coverage. Yeah, that's pretty cool to have dental coverage. I need that. I ain't got a lot of teeth left in my own mouth anymore at my age. So having dental is pretty important. Vision, yes. Hearing, well, I'm covered to the VA on that, so I'm not sweating no bullets on that deal. Next question is, what should I consider when looking at plan options? Evaluate the cost of the plans available in your area, including monthly premiums, deductibles, co-payments, and maximum out-of-pocket amounts. Review your local health care expenses from your past year and anticipate what you may spend in the coming year. I guess that's kind of a good way to look at it. If you don't have a lot of medical, maybe Medicare is not for you. But if you can get a zero premium, it is for you. It's something you need to jump on. Original Medicare provides coverage through any provider that accepts Medicare. However, it typically only covers about 80% of the cost. Hint, hint, remember what I just told you? If it's zero for the policy and it covers 80%, hopefully and most likely the VA is going to kick in the other 20%, as long as it's approved through the VA, or vice versa, with no limits for your proportion. Medicare Advantage plans include maximum out-of-pocket costs, but they use provider networks, so verify your healthcare provider participates with the plan. So sum that up all in a ball of wax. If you go to a doctor and he's not on the network, it looks like you're going to be paying for most of that out of your pocket. That's not a very good deal. So you'd want to make sure damn well that you're going to go to a doctor that takes care of that and uses that Medicare Advantage plan. Where can I go to get more information? Look to credible sources such as Medicare.gov or licensed sales agents to compare plans and estimate costs. Veterans and Medicare households have access to Humana customer care specialists who collaborate with USAA to receive special training to better serve the unique healthcare needs of veterans. Now, if you really want more information on that, like it says here, you may want to sit down to receive special training from someone that sells these plans. It states here again, look to credible sources such as Medicare.gov or licensed sales agents. And that's damn sure what I'm going to have to do. I'll be turning of age to get Medicare in probably about the next 8-9 months. So that was a question I had. Should I get Medicare and have the VA covered? Well, I got VA, so should I get Medicare, I guess you could say. I think I will after I see the information I see here. That's a decision you're going to have to make yourself. But do your research, study well, then make that decision at that point in time. Get advice from professionals. Well, guys, I hope this video shares some information that might be helpful to you. And if it did, make sure you hit the thumbs up, like, and subscribe. That way this video will get out there and reach other veterans or other people that have the same question that I just addressed here. The answers are here. Study, look, and listen. If you hit the thumbs up, like, and subscribe, this video may get out there to other veterans that need it. And also YouTube looks at it like, the longer this video is played, the more likes and subscribes, the more it helps this poor little channel I got here. And God knows I need the help. I am disabled. I got a speech impairment, bad problem over here in the ear, no vision in this eye. So I'm not the perfect YouTuber out there, but I'm trying to pass on information that might help you. Again, God bless you and thanks for watching. See you in the next video.